Good. So Vanessa, today we're going to. My name is Daniel. I'm sure you met before, haven't we?
Yes, we have.
Good. So today I am going to tackle a lecture on health and safety in the health and social care workplace, and our aim is to ensure that students are able to develop and understand the risks and responsibilities of health and safety in the health and social care workplace. Okay. Um, Learning outcome one, and that is what we are going to do today. Um, we are going to look at um, the how understand how the health and safety legislation is implemented in the health and social care workplace. And for these purposes, one of the main assessments for the learner is that you should be able, by the end of this lecture, you should be able to review systems, policies, and procedures for communicating information on health and social care, on health and safety in health and social care workplace in accordance with the legislative requirements. Very important. So we expect that you should be able to review the systems and policies and be able to understand them according to the workplace and the legislative requirements. So that's 1.2, and that's what we are going to look into. So bear with me, and then I'll put quickly go to LO1, and then we can take it from there. Right. So LO1. That's very good. Share. Screen sharing. Okay. That's sharing. Just bear with me. Can you see the screen, please?
Yes, I
Vanessa.
can.
Hello.
Yes, I can see the screen.
Vanessa. Vanessa.
Yes,
Hello.
please.
So Vanessa. Hello, Vanessa. Hello, Vanessa. Vanessa, can you hear me?
Yes, I can hear you.
Yes. Initially, I couldn't hear you. I don't know.
I beg your pardon?
I couldn't hear you about 5 minutes ago. I couldn't hear you. Okay. I said about 5 minutes ago, I couldn't hear you at all. There was a break of connection.
Okay.
That's fine. So, like I did say, learning outcome one, we have to understand how the health and safety
Yeah.
legislation is implemented within the health and social care workplace. Now, we need to look into, first of all, when we say when we are being told or questioned what is health and safety, and therefore it's just the regulations that governs the workplace to prevent accidents or injury, either in the workplace or the public environment. That's basically what is health and safety. Anything that is done or any measure that is taken to prevent accidents or injury in the workplace or public environment, that is health and safety. Okay. And then we have to look into pertaining to the health and social care. So general description of health and safety, but in health and social care, it then becomes a more occupational, and hazard occupational that relates to preventing accidents or ill health against employees or those that may be affected. So health and safety then becomes a general term within the health and social care, that anything that is done to prevent accidents or ill health against employees or even the employees or employers as well. For example, we can talk about health and safety in care homes. It's about identifying risks and how they are managed, controlled, or prevented. It is every member of staff duty to care. So what it means that health and safety is not only the duty of employees, Vanessa, it is also the duty of employers. You understand me? Okay. Can you hear me? Hello? Can you hear me, please?
Yes, I can hear
That's
you.
fine. That's fine. So health and safety is not only the requirement of employees, but it is also requirement of employers. However, they expect employees to create that enabling environment for all, ensuring that they are complying with the health and safety regulations or compliance for the care home or the organization. Employees' duties are to comply and make sure they adhere to those health and safety policies or health and safety measures that have been placed in the workplace. So once we talk about health and safety, then we have to look into the risks and hazards. Okay, risks and hazards, where hazard is anything that can cause harm. It could be chemical, electricity, anything that can cause harm. But the risk is the chance, whether high or low, that a hazard would actually cause somebody harm. So whilst the hazard is anything that can cause harm, the risk is the chance that hazard may occur and the impact. So a practical example is working alone from your office can be a hazard. The risk of personal danger may be high. Electric cabling is a hazard. If it has snagged on a sharp object, the exposed risk placed in there is very high. So it means that the risk can be low or can be high, pertaining to the situation. So when there's a fire outbreak, the risk can be high. And when there's no fire outbreak, the risk may be low. And that's the meaning of risk assessment. So we always do what we call risk assessment in care. Okay. And then how do you minimize those risks? So minimizing of risk is the process of doing everything possible to reduce the probability of those things, those hazards to occur. Okay. You doing that is why there are policies that you have to follow. You have to make sure you put aprons, you put hand gloves, and if you want to touch a chemical, you are trying your best to minimize anything that will cause any hazard. Okay. And in so doing, you are able to identify, assess, and control issues or things that may risk or hazard that may occur. All right. All right. There are 4 ways to minimize this risk. It can be avoidance, acceptance, reduction, or control and transparency. So there are 4 ways for which a carer or a personnel may choose to assess or minimize those risks. And those are avoidance, acceptance, reduction, or control and transference. Now, let's look at the responsibility and liabilities. When we say somebody is liable, it means that the person has duty of care towards what the person has been assigned for, and therefore you are liable for. So liability is therefore is usually used for law or rules. For example, someone is liable to pay for damaging another person's car, computer, or toy, and that is true. If you damage anybody's thing, you are the one that will be liable for you causing the damage. If you are driving on the roadside and you hit your car with someone, you are liable for that hazard that you have caused to the car. and therefore your insurance will have to come in. So those are what we call liability. And then responsibility is having something in your care you are responsible for. So if they put a patient in your care, you are responsible for the patient. Okay, and that's responsibility. Anything that is given in your care, it is your responsibility to make sure that everything is safe and you handle the thing over as it is. So it could be a human being, it could be a child, it could be a pen, it could be a pencil, it could be monetary. Okay. Okay. I'm responsible for driving safely. If I crash, I'm liable to pay for the damage. Of course, that is true. So if you're a driver and you are being assigned to be driving people, your duty is that you drive them without no accidents. Once there's accidents, you are liable for that. Okay. And that can lead to imprisonment or that can lead to law enforcement. Okay. All right. Well, we can watch this video and then 1 minute. Let's watch this video and then can you see the screen?
I beg your pardon, National Director of Patient Safety. A National Patient.
Okay. So could you hear me on the video?
Yes, I could.
That's fine. That's fine. So let's proceed. The video talks about improvements within safety and improvement. So the video was talking about all the people that were interviewed. They were making a point that once there is health and safety, there should be a room for improvement, because once there are any accidents, anytime there are accidents or anything that brings about harm, there should be a room where there is improvement so that new policies are put in place to review whatever happened in the past. That leads us into what we call the Health and Safety Act at Work 1974, which seeks to address workplace issues in the UK, and provide a safe working environment for staffs and employees. Okay. So key component is that 1, it provides safe place for work. 2, it provides safe equipment. 3, it ensures staff are properly trained. 4, ensure you carry out risk assessment, provide proper facilities, and 6, appoint a competent safety officer. Okay. Now, so every organization that has issues with safety or the jobs relates to health and safety, there should be a safety officer in charge for overseeing some of these occurrences. Okay. Then we have to look into how we can manage the health and safety at work compliance. One of the key compliance that an organization needs to adhere to is the ISO 45001. It is a good way to both manage occupational health and safety and evidence that your workplace is compliant with the Health and Safety at Work Act. Following the framework of the standard ensures that all aspects of health and safety at work are covered and also managed in a different way to provide assurance to employees, regulators, and employers alike. So the health and safety organization that you need to adhere to is what we call ISO 45001. Okay, it is the international code that an organization needs to adhere to. Then we can look into the health and safety regulation 1981, what we say IHSCO. Okay, health and safety first aid 1981. What it seeks to do is that it requires employers to provide adequate, appropriate equipment, facilities, and personnel to ensure their employees receive immediate attention if they are injured or taken ill at work. So the onus lies on the employees to provide this adequate equipment or F8 equipment in their place, like things like paracetamol, when you have any cuts, you have tape to put on. Those basic things, you need to have them. Okay. So the Health and Safety First Aid Regulation 1981 seeks to address some of these things that employers need to have for employees. What then is the 6 points of first aid regulation? The 6 points: safety pins, 2 large individually wrapped sterile unmedicated wound dressing, 6 medium size individually wrapped sterile unmedicated wound dressings, at least 3 pairs of disposable gloves. So these are the things you need to have in your first aid box, or what we call the first aid regulation. It must have pins, it must have 2 large individual wrapped sterile unmedicated wound dressing. You need to have all these things in your first aid box. Very, very important. Now, we need to understand the management of Health and Safety Act Regulations 1999, were introduced to reinforce the Health and Safety Act 1974. So it's just a reinforcement. 1999 comes to reinforce the one for 1974, because the first one is the 1974, and then the 1999 comes to reinforce. In other words, it improved on the previous one. It therefore should align what employees are required to do, what employers are required to do to manage health and safety, and apply to every work activity. The regulation places a set of duties on employers and employees to maintain health and safety and healthy workplace. Very, very important. Okay. Then we have to also look into, it requires employers to carry out risk assessment, make arrangements to implement necessary measures, appoint competent people, and arrange for appropriate information and training. So employers need to carry out this risk assessment before they could even have an organization in place or bring in staffs. Very, very important. Risk assessment is very important. That would inform you the kind of support patients will need or service users will need. Very important. Then lastly, the employers with 5 or more employees must record any significant findings. Once you have more than 5 employees, everything that happens regards to health and safety, you need to record them. Very important. And then employers are required to appoint at least one competent person. I've discussed that already, to oversee and supervise, assist in all matters. I've explained that. Employees must provide all necessary safety information in an understandable format. Similar appropriate health and safety information also need to be provided to temporary and non-temporary staffs as well. Okay, to temporary and non-temporary staff. Then we have adequate health and safety training must be received by every employee. Very important. In addition, workers should not be given tasks beyond their competence or physical capabilities. Very important. Well noted. Okay. Adequate health and safety training must be received by employee. In addition, workers should not be given tasks beyond. Very important. Where employers are sharing premises with other employer, it is necessary for the employers to cooperate and coordinate health and safety activities. Information from risk assessment and the resulting preventative measures must be exchanged between employees. Between employers. So what then is employee duties? What then are the employee duties? So employees should have duties like report any health and safety shortcomings, report dangerous situations, as well as actual accidents and incidents, report equipment in accordance with training and instruction, take reasonable care of their own health and safety and the safety of anyone affected by their work. Very important. Okay. Vanessa, at this stage, do you want to ask any question?
No, please.
Okay, let me proceed. These are the duties. These duties supplement and support employees' duties under Section 7 of the Health and Safety Act 1974. Okay, these duties supplement and support the employees' duties under Section 7 of the Health and Safety Act. Okay, then we proceed to reporting of injuries, diseases, and dangerous occurrences regulations, what we call RIDO 1995. And in this regulation, it is geared towards, channeled towards how employees should know when to report accidents when they occur in the workplace, whether be it yourself or your patient or a staff. And you need to ensure that you have been able to understand the formalities and the time frame for which you have to report to management. What must be reported? Deaths and injuries caused by workplace accident, occupational diseases, biological agents, specified injuries to workers, dangerous occurrences, gas incidents. Further reading or reader on the DiHSC website would help as well. It will help. Then cost regulation impose duties on employers to safeguard of the health and safety of employees and other such as contractors and visitors. Okay, so you would also look into cost regulation impose duties to employees to safeguard and health and safety of employees and others that may be affected by hazardous substances within their workplace through combination of risk assessment. And then can you hear me? And then it looks like I can your voice is okay. So
Yes, I can hear
you can hear me, okay. So I say that cost regulation impose duties on employers to safeguard the health and safety of employees and others. Okay, so let's look at the occupational use of under cost control of substance hazardous to health and safety. Cost is the law that requires employers to provide to control substances that are hazardous to health and safety, health and includes monomaterials, nanomaterials. You can prevent or reduce workers' exposure to hazardous substances by finding out what are the health hazards are, deciding how to prevent how to health, providing control measures to reduce harm to health, making sure they are used, keeping all control measures in good working order, providing information, instruction, and training for employees and others, providing mentoring and health surveillance in appropriate cases, planning for emergencies. So these are key things that we need to know. All right, then we have to look into the regulatory reform, Fire Safety Order 225. This order requires employers to provide training to all employees. The order was provided to give minimum level of fire safety provision to domestic abuse. So the order was provided to give minimal level of fire safety provision in non-domestic properties. Okay, the control of substance hazardous to health and safety regulations 2022. This puts a responsibility onto employers to protect employees from hazardous substances at work. There should be a risk assessment to determine the risk of exposure as well as what procedures are used. So let's proceed. So then we have manual handling and operations population. Manual handling and operations. We set out duties to ensure safety for a whole wide of manual handling activities, including lifting, lowering, punching, pushing, firing, anything related to manual handling. The load may be either animate, such as a person or animal, or inanimate, such as a box or trolley. The main aim of manual handling is to prevent injury to any part of the body. That's the meaning of manual handling. So that you can carry things in a very professional way, having learned the weight and what the manual handling course seek to teach you. That is all. And then you are done. And then the regulations are there to help to avoid assets and reduce the risk of injury from manual handling. Therefore, they need to make sure they are following. They have to make sure they are following them closely to ensure they keep a healthy and happy team. Okay, the regulations help to avoid access and reduce the risk of injury from manual handling. Therefore, they need to make sure they are following them closely. You have to make sure you are doing the right thing so you don't have any manual handling issues. What are the responsible of compliance and what needs to be honest? Compliance. And why is it? Who is responsible for compliance and what needs to be done? Okay. Manual handling operation regulations make it a requirement for employers to manage the risks at the employees to the employees. Do all that realistically. Okay. Do all that.
I beg your pardon?
Can you hear me?
Yes, I can hear you.
Okay. I am in manual handling. Are you there as well? Can you see it?
Yes, I can.
Okay. So I'm saying manual handling operation regulation, it make it a requirement for employers to manage the risks for the employees by doing all that realistically possible to avoid risky manual handling operations, making a suitable and sufficient risk assessment, and then finally reducing the risk of injury from operations so far as soon as possible. So for avoidance and decision of avoidance and reduction of risk can be achieved by redesigning the task or working environment or introducing automating and mechanical assistance to this process. It means that we can avoid manual and we can start using automated or technology machines that will help in manual handling. Because manual handling itself, if not properly done, you can hurt your back or your body parts. Okay. Medical and scientific knowledge stress the importance of ergonomic, high comfort-based approach that looks at manual handling in the workplace as a whole, tackling into an account the nature of the task and the load and working environment and requiring water participation. hotel participation. Okay, let's look at Food Safety Act 1990. Food Safety Act 1990. The Food Safety Act 1990, as amended, provides the framework for all food legislation. In other words, if you work in a care home or in a hospital, it is important that you give food to the patients, and this food needs to be prepared well balanced, and well catered for. So food safety is very important. Okay, food producers serve or sell it substance or quality which consumes well respect. Business do not need anything in food. Remove anything from food or treat food in any way, which means it should be damaging for the health people to eat. The food is labeled and advertised, and because the person may be very angry, going for that, very, very bad. And we have to also look into the food labeling. When the food is opened, it needs to be labeled and put in a container. We don't put the things in the fridge. And then lastly, food business or sale of nature substance quality consumers would expect. So it should be of high quality when this food has been served. Okay. The purpose of Food Standards Act 1999 is to establish as the Food Standard Agency. It is there to provide us with functions and powers and to transfer certain features in relation to food safety and standards. Oh, hold on. What's the problem? No. Can you see the screen, please?
Yeah, I'm seeing the screen,
Okay, 1 minute.
but it is showing something different.
Yes, something happened. Guess what? Something like this. So 1 minute, please. Can you see the screen now?
Yes, I can.
Okay, that's fine. So I've just spoken about Food Standard Act. We spoke about food safety, and the Food Standard Act is established as a food standard agency, and their duty is to ensure that certain functions relating to food and safety standards are obliged. So if you want to buy and import something from Africa to UK, you need to have a food standard approval. Understand? They set out main goal to prevent public health related to food. They give us the power to act in the consumer's interest at any stage in the food production and supply chain. Very, very important. And you can read more about this in the website that has been given, www.food.gov.uk. Okay. There we can talk food safety, general food hygiene, Regulation 1995. This seeks to talk about how food should be handled, how they are stored, how they are packed, how they are transported. These are the functions of the General Foods Regulation 1995. Okay, so how when you have your food, how do you store them in the fridge? At what degrees Celsius do you have to store them? Those are the things that it talks about. And the Department for Environment, Food and Rural Affairs handles that. This regulation sets out basic hygiene requirements for all aspects of your business, from your premises and facilities to the personal hygiene of your requirement of the regulation. Very important. Very, very important. These are the regulations that set out the hygiene requirement for all aspects of your business, from your premises and facilities to the personal hygiene of your staff. This is what regulation, the food safety, general food hygiene regulation 1995 seeks to do. How you store your food, how you transport your food, how you display them, how you pack them. Okay, it must comply with the law. Very, very important. And there's a video here that you can, there's a website here that you can pick up in your slides and read more about it. And then now we have the Workplace Health and Safety and Welfare Regulation 1992. This covers a wide range of basic health, safety and welfare issues and apply to most workplaces, except this involving construction work, welfare lies, and then it says Health and Safety and Welfare Regulation 1992 covers a wide range of basic health, safety, and welfare issues and apply to most workplaces, except those involving construction work on construction sites, those in or on a ship, or those below ground at a mine. Okay, so it talks about all this. Any work safety, welfare issues apply to most workplaces except the construction site, those on a ship. It also says that it will help employers understand the regulatory requirements on issues such as ventilation, temperature, lighting, cleanliness, room dimension, workstation, seating, floor conditions, fall or falling object, transparent and translucent doors, gates and walls, windows, skylights, ventilators, traffic routes, escalators, sanitary conveniences, and washing facilities. These are the things that constitute the other one. Then we have the PPE at work. PPE at work. In the employers have the basic duties concerning providing on use of personal protective equipment, PPE at work. PPE there is defined as a regulation where all equipment, including clothing, affording protection against the weather, which is intended to be worn or held by a person at work, and which protects him against one or more risks. To be fair, these PPEs are meant to be provided by the employer, by his employees' duty to adhere or use what has been given to them. Example: safety nets, apron, nose mask, safety harness, safety wear, safety helmets. All those are things that are important to be adhered by the employees. Then we have the main requirement of PPE at work regulations, that PPE is to be supplied and used at work whenever they are in any ways. It also required that PPE is properly assessed before we ensure, and then provided with instruction on how to use it safely, and then used correctly by employees. More reading on the PPE or so. And then the last bit is maintain and store properly, provide with instruction on how to use them safely and use correctly by employees. You can read more on the www.dhse.gov.uk. Okay, then we can look at electricity at work regulation 1989. Electricity at work regulation apply to all aspects of the use of electricity within the workplace. Duty holders must have electrical systems constructed in a way that prevents danger, maintain electrical system as necessary to prevent danger, carry out work on electrical system. Okay, very important. Electrical equipment should, in hazardous environment, must be constructed and protected to prevent becoming dangerous. This includes extreme weather, extreme temperature, and corrosive condition. Lastly, the employers then should only work on it or with electrical equipment if they are suitable, have suitable training, knowledge, experience, and supervision. Okay, employees and not employers. Employees can only access anything electrical when they have been vetted and have the necessary training. That is why that is the only time they can use them, that they're going to cause huge problem. You cannot touch any electrical hazard when you have not been trained. Very important. Okay. The Health and Social Care Act 2028. The Act 2028 requires all providers of regulated activities in England to register with the Care Quality Commission. Very important. And to comply with the regulations and fundamental towards set out regulation mode under the Act. The bill seeks to Hello, Vanessa, can you hear me?
Yes,
Hello?
I can.
Okay. So the Health and Safety Act 2008, it requires companies to register the CQC as the watchdog for care providers. Okay, in the UK, it's called CQC, Care Quality Commission, and its focus is on providing assurance about the safety and quality of care for patients and service users. The main aim of the act is to change how NHS care is commissioned through greater involvement and clinicians and new NHS Commission Board to improve accountability and patient voice, to give NHS a new freedom to improve quality of care, and to establish a provider regulator to promote economic, efficient, effective provision. In addition to that, the Act will underpin the creation of Public Health England and take forward measures to reform health bodies. Then we have the Care Act 2000. The Care Act 2000 set up Commission for Social Care Inspection, which established a new system of national minimum standards for all residential and nursing homes and domiciliary. So when you say domiciliary, is home care, door to door. Its primary function is to promote improvements in social care. The Care Standard Act 2000 was introduced to regulate and ensure that agencies and providers were competent in their duty of care and to develop a level playing field for all service providers of social care, early years and social services by regulating, inspecting, and reviewing services accordance with the Act. Very, very important. Okay. Then we have the Mental Health Act 2007. The Mental Health 2007 is an amendment of the 1983 Mental Health Act designed to give health professionals the powers in certain circumstances to detain, access, and treat people with mental disorders in the interest of the health and safety or the public safety. The main purpose of legislation is to ensure that people with serious mental disorders which threaten their health or safety of the public can be treated irrespective of their consent where necessary to prevent them from harming themselves or others. Down below is the link that you can copy and gather more information from. Then you have the Disability and Equality Act. While the Disability Act, you have a physical or mental impairment that has a substantial long-term negative effect on your ability to do normal daily activity. That's the Disability Act. What substantial long-term means? Substantial is more than minor or trivial. Long-term means that 12 months of illness or more, aging, breathing condition that develops to a result of lung and all that. You understand? Then we have progressive condition. Progressive condition is the one that gets worse over time. People with progressive condition can classify as disabled. However, you automatically meet the disabled definition under the add to the end with the delay and you are diagnosed with HIV infection, cancer, or multiple sclerosis. Okay. Equality Act 2010 makes sure that all of the protected characteristics, age, disability, gender, mother, civil partnership, pregnancy, maternity, race, religion, sex, sexual orientation, all, it covers almost all. Then the Children Act 2024. The Children Act 2024 is a development from 1989. The Act is reinforced that all people and organizations working with children have a responsibility to help safeguard children and promote their welfare. Very important. The organization should have a policy that have safeguarding against the children. The guidelines set out in this act allow for any working in educational and non-educational setting working with children to know how a child should be looked after in the eyes of the law. Very important. This act's purpose is to make UK a safer place for children and allowed for creation of children's commissioner, as well as each local authority needing to appoint a director of children's service. It also allows the government to create electronic records for every child in England, Scotland, and Wales, which turns it easier to trace children across local authorities and governments. Very important. The Act is to make provision about powers and duties of local authorities and other bodies in England relative to the improvement of well-being of young children, to make provision about the powers and duties of local authorities. Okay. The key outcomes of this Child Act is be healthy, stay safe, enjoy and achieve, make positive contribution, and then achieve economic well-being. Okay. So lastly, we have to look at specific organization from publishing and implementation of a social care aging. Look at a specific organization that from its publishing and implementation of health and safety aging, health and safety policy, employees, equality policy, discrimination policy, data protection policy. Okay. And who is DPO? A management of standards, like a care. Those are DPOs. Oh God. Are you there? Can you hear me?
Yes, I can.
Okay, just 1 minute. So Okay, so one of the key health and safety policies is the health and safety policy, and that is for employees, equality policy, discrimination policy, data protection policy, and then who is who is DPO? Management of standards like care, priorities in specific workplace to consider, safety of staff, safety of service users, and then safety of visitors. And then lastly, you have to look at, get hold of health and safety policy for the health and social care organization. That's the question. Read the policy and take out the summary in terms of employer priorities, employee private responsibilities, legislation requirements, as in a first aider, HS training, fire marshal, incident logbook. Incident workbook is when an accident happens. You have to put that information there. First aid box and health and safety poster. Okay. And the references, you can have everything. Those are the ones written downstairs. Those are the references. So references is, you can get the references from www.hsc.gov.uk, www.hsc.gov.uk, you know, all the www England, NHS UK, you can get all this information from this reference on your student models as well. So in general, read additional article on accident prevention and protection from harm on patient info. You can get those links, is written there, patient info doctor, and read an article which forms the basis of the HASCO Act, the Health and Safety Work Act, Health and Safety Management of Regulation 1999. Read about that. Any questions at all, you can email us or you can let me know and I'll help you. Vanessa, do you have any question?
No, I don't.
Okay. Your model, if you go on your model, you will see your first question, which we are going to, your first question, you are going to see there on the learning outcome 1. So if you go your model, so let me see if I can get something here.
Okay, please.
So a minute.
Thank you.
You're welcome. So, can you see the screen? Can you see the screen?
Yes, I can.
So if you see learning outcome 1, task 1, if you see there, we'll do that later on. If you look task 1, can you see?
Yes.
Okay, so it says the health and safety subcommittee of a senior management wishes to ensure that they've considered all the relevant health and safety legislation. You should research relevant legislation and analyze its implementation. Compile a report that one reviews the systems, policies, and procedures for communicating information on health and safety in your chosen workplace in accordance with legislative requirements, and identify how it complies with legislation and areas where it does not. Okay. 2, assess the legal responsibilities for the management of health and safety in relation to the organization structures. 3, analyze health and safety priorities appropriate to your chosen workplace. And then 4, attach a bibliography of your research and resources. Okay. Evidence required. Are you there?
I'm there.
So if you look at it, with the 1.1 say you are required to report all relevant legislation for this chosen area. Reports should comprise a detailed review identifying how the organization's communication of health and safety information complies with the legislation and any area which it does not. So this is your first question, which is also on your student model. Okay. Task 1. Any question at all?
No, I don't have any question. I'd actually gone through this before the lesson. I'd gone through on my model.
Amazing. Amazing. Good. Good. So you can start, if you read through, you can get all the answers from your lecture notes, and then stick to the instruction that they're giving you your questions. And as they said, they want a report. So stick to that and you'll be fine. Okay.
Okay.
All right. So I think, are we meeting tomorrow? What's the next lectures?
I'm not sure, but according to what I was told, that it will be happening every Wednesday.
Every Wednesday. Okay, that's fine.
I think they'll get back to both of us.
No problem. I'll check as well. I'll let you know. Okay.
Okay.
All right. Take care.
Okay.
Bye.